Hello, and thank you for joining us today for Business Monitor International's Analyst Briefing. Today's briefing is titled Global Telecare, Healthcare for the Digital Age. My name is Manpreet and I'm your host for today's session. The briefing today will be presented by Laura Holland and Kaushal Shah and will last approximately 40 minutes. At the end, the team will take your questions which you can post using the button at the bottom. Lastly, could we ask you all to mute your phones throughout the presentation? I'm now going to pass over to Kaushal.
So there are many terms that describe the use of technology to provide healthcare, including mHealth or e-health. We have chosen to use the word telecare, which we define as the use of mobile and internet technology to provide clinical care and non-clinical services such as health education, disease surveillance, and drug monitoring. So it's our view that a combination of factors is driving growth in this industry. This includes the continued growth in demand for and delivery of healthcare, continued growth in mobile and broadband subscribers and penetration rates, and the growing sophistication of the infrastructure of communication networks. So, telecare is a global industry, and we expect the combination of factors to create significant revenue earning opportunities for companies operating in both the developed and emerging world. So in developed markets, governments are using telecare to improve healthcare delivery efficiency, to, for example, reduce treatment waiting times, and to reduce the burden on overstretched national health service public finances. In the emerging world, governments are adopting telecare as a complementary strategy for strengthening healthcare systems that are paired for human resource and healthcare facilities. There are stakeholders already involved in this industry, including governments, drug companies, insurance companies, telecom operators, and software vendors. Looking at the types of telecare, we split the industry into 5 different areas. These are self-care, disease surveillance, outpatient care, drug monitoring, and health monitoring. The reason we've divided these up is to allow us to look at different areas in more focus and ensure that we're considering the market's most important factors when looking at the opportunities that are available there. We've defined these different ways which you can look at here, and this takes a look at the niche areas of the wider telecare industry. As we say, our definition looks at the widest possible view of the market, so this is a more drilled down look at what's going on. From these 5 areas, we've created an opportunities matrix. We started off with the technological base, so looking at what the actual infrastructure is in place from an IT and telecoms perspective to allow telecare services to expand. This can be as basic as access to power and up to ICT Development Index, which is an index created by the ITU, looking at the acceptability and how people respond to telecoms and IT services in a different market. Once we've looked at those, we separated these into excellent, average and poor. Could I just take a moment to ask you just to remind you to pause your phones, just because we're getting a little bit of background noise. Thank you. After looking at the tech base, we then went on to the market opportunity. This is looking at the healthcare side. This can be areas such as disease burden or healthcare expenditure, but also things like population density and the pensionable population. An older population is obviously requiring more healthcare. Again, we've allocated these high, medium and low ratings, and then from that we've looked at the investment opportunities for each different area using the technological base and the market opportunity. So taking, for example, the idea of self-care, we looked at different areas that would be important for the rollout of self-care services. We see self-care as a service that consumers will demand rather than being one that's pushed from healthcare providers. For this reason, areas such as 3G subscriptions, mobile penetration, and average revenue per user indicate that customers are used to using telecom services or IT services, but also they're willing to spend on these services. From the point of view of the healthcare industry, there's already high expenditure on drugs and private to final consumption, but also a non-communicable disease burden, so chronic diseases that require long-term care. We've then ranked these and given them different weightings. So the non-communicable disease burden is very important as far as we're concerned for the healthcare side, for the market opportunity side, whereas customer willingness to spend on services, average revenue per user, and the ICT development index indicates that customers will be likely to use these services and take them up. From here, we've got our view of the markets with the greatest opportunities and good opportunities for self-care services. Markets that particularly stand out are Western Europe, and North America, and developed Asia countries. Reason for this: telecom services are already available in these markets. Customers are used to using services, and particularly in the area of smartphones, this is where smartphones have proliferated, so apps and new developments and technologies to use these services have rolled out